Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford, and joining us today is Dr. Ugo Ezema, a pulmonologist and critical care specialist at Terrebonne General Pulmonology Care. Welcome to the show, Dr. Ugo.
Thank you. Always a pleasure to be here.
Well, thank you so much for joining us today. Let's get to know you a little bit better. Can you tell us more about yourself and your role at Terrebonne General?
Absolutely. Ugo Ezema, that's my full name, but I go by Dr. Ugo Ezema, Dr. E, or Dr. Ugo. Originated from Nigeria by way of Jamaica, came here to Nicholls State, and been here since then, now a Bayou boy. Met my wife at Nicholls State, and essentially finished off my medical school back home in the Caribbean, and Chabert for residency, Tulane for my fellowship in pulmonary critical care. And I've been here since for the last 5 years.
Oh, that's wonderful. We're so glad to have you.
Thank you.
Let's dive into today's conversation. We're talking about COPD, a very important topic around here. Can you tell us what is COPD? What does it stand for?
It's a really good question. I mean, COPD, it stands for chronic obstructive pulmonary disease. And all that means spelt out is chronic, meaning it's over a long period of time. Obstructive, meaning that there's airflow in your lungs has been limited. So air can't flow in and out as smoothly as it's meant to be or it's supposed to be. And lung disease, so lung and problem, something is happening, something is a defect in how all of that process works.
And how does this differ from other chronic lung disease?
It differs in a way because I think primarily it is one of the most common presentations of lung problems. A lot of lung problems do actually present the same way, but it's the most common, mostly because of the susceptibility of the lungs to all of the irritants, and most importantly in this case is smoking. So it's the most common attached lung disease to smoking. And that is a unique thing in terms of prevalence where smoking and lung diseases is associated. Other things that it's related to is like asthma, for instance, which is also an obstructive lung disease. But the difference between COPD and asthma is the obstruction that's created with COPD is permanent, and the one that is present in asthma is transient. So it's intermittent, so it comes and goes. And that's a big difference between that and COPD and asthma, for instance.
So is there other things besides smoking that cause COPD?
Absolutely. While smoking is the most common root cause that we associate with COPD, other things include air pollution, whether that be indoor or outdoor, occupational exposure to chemicals, fumes, gases, and you can have genetic predisposition to it as well. And that's, while rarer, it's one of the things that we do test for people, especially non-smokers. And any history of frequent infections. So if you're having a lot of infections, especially as a child or as an adult, any recurrent damage to the lung can ultimately lead to COPD.
Another thing I wanted to ask is about vaping. You hear so much about vaping these days and that it's supposed to be safe. Is that something that could cause COPD?
I always tell my patients and students, the lungs are meant to take in air. Anything other than air, good quality air, is probably not good for it. Vaping, while it's a lot of people use it as a substitute for smoking, it does still contain particles and chemicals and irritants that still can cause damage to the lung. I think it's important to note, of course, that we don't know and we don't have a lot of long-term information and long-term data on vaping. Vaping is a relatively new phenomenon. And if you remember, I had mentioned that COPD is something that occurs over years of damage. We just haven't had that amount of data, but the initial studies that we have had so far do connect vaping and COPD and other lung problems as well. All in all, don't smoke, don't vape.
What are some early warning signs of a patient with COPD?
Early warning signs are your typical lung symptoms, right? So cough, a cough that's usually not provoked, or a cough that just comes and goes without any particular thing that's causing it. Shortness of breath. And in terms of early warning sign, if you notice that you're walking a little bit slower than your colleagues, or you're avoiding stairs and avoiding walks in general, it might mean that you are subconsciously trying to, or you're subconsciously avoiding things that are giving you some exertion that will precipitate you being short of breath. So cough, shortness of breath. If you're having a lot of sputum, having some sputum, clearing your throat is another early sign that could be associated. But now any one of these could be associated with other things. COPD is technically what we would call a syndrome. What you want is a group of things that make sense that could help you to that diagnosis.
And how does COPD get diagnosed?
Gets diagnosed with good history taking, finding out when the symptoms started, how long they've been going on for. The most important thing I would say is having a good history, good physical, as well as having a pulmonary function test. It's a test that we use to test how fast you can blow out the air in your lungs and how quickly and how much of that you can blow out. So it's a test that a lot of my patients don't enjoy. It doesn't hurt in any way, but it does give us a lot of information that helps us diagnose COPD as well as other lung diseases.
So is the diagnostic approach a little bit different for someone who is a smoker as opposed to a non-smoker?
That's a great question. I think the initial diagnosis is about the same, right? So we would still get, and most of medicine is getting a really good history. I think if you pay attention to the patient, they will tell you what's going on. So a good history, a good physical exam, and a pulmonary function test are the cornerstones of COPD diagnosis. Particular to non-smokers, you want to pay attention where the history is concerned is to other causes or other places that they might be getting irritants or exposure to chemicals, fumes, secondhand smoke. So you dive into their life to see where else they could be getting long-term exposure to things that could lead to long-term lung damage and long-term lung inflammation. So that's where that history component is. Particularly in non-smokers, you want to think about a genetic predisposer. And there are a few genes that if you don't have them, means that you're not producing certain things that are necessary for your lungs to function at full capacity. The most common one is alpha-1 antitrypsin. If you have a deficiency of that, you don't have good lubrication of the lung, and that can ultimately lead to poor airflow and increases the risk of someone having COPD, particularly at a younger age.
And that could be for someone who is a non-smoker that
Absolutely,
would have it.
absolutely.
So it would be
absolutely.
some type of a genetic problem.
Yeah, it's a blood test that we test to see about if there's a deficiency of that enzyme.
And what about the treatment for a smoker versus non-smoker for COPD?
The treatment is probably going to be the same.
Okay.
We treat with the cornerstone of any healthy treatment or any healthy treatment plan, any good treatment plan is exercise, of course, and good nutrition. On top of that, inhalers that help to open up those airways to allow the air to go in and out, avoiding irritants and future irritants. So this is where vaccines come into tremendous benefit. So if you want to avoid getting the flu when it's flu season, for patients that are a little older that get the pneumococcal vaccine, we talk about the COVID vaccine when that's necessary. So getting vaccinated to help prevent further damage to the lung, breathing treatments, exercising. Exercise is a treatment for the lung. It's a treatment for your body. I always recommend exercise, and rehab is a form of exercise too. So we have pulmonary rehab that we can send some of our patients to. So all in all, eating well, exercising, inhalers, breathing treatments, inhalers, avoiding irritants, so no smoking, no vaping, avoiding further damage to the lung via infections and via vaccines rather, and preventing those infections.
Preventing those, yes.
Yeah.
That's very good promotion for vaccines there.
Yes.
I know a lot of people are, a little leery, but if you're at risk, it really is good to get the vaccine.
Absolutely. And if you have any questions about anything related to medicine, it's good to talk to your physician, talk to your provider to help clarify any misconceptions or any questions. We are here to be helpful and to help you be an informed patient. the best patient you can have is one that is informed and knows about what and feels emboldened about the decisions that they are ultimately making for themselves.
Right. Speaking about misconceptions, what are some common misconceptions that people have about COPD?
That it only happens to smokers,
Mm-hmm.
and that it only happens to older folks. Those are misconceptions. We see all sorts of people that have COPD. Again, COPD manifests itself in a wide variety of ways. We can call it, depending on the presentation, chronic bronchitis.
Mm-hmm.
We can call it emphysema, depending on what your symptoms are, what imaging we have of your lungs that might show emphysema, and what your presentations are. But it can occur in anyone, adult and above. Of course, if you're a little younger, we're talking about maybe it was a genetic something leading to it, or just a freakishly large exposure, long-term exposure at an early age that could lead to that. So it can occur in almost any adult. It can occur, and it doesn't just happen in old age. Yeah.
What preventive steps can people take to prevent lung damage? I know you mentioned some.
Don't smoke.
Don't smoke, for sure.
Don't vape. That is a long way to go. Preventing infections for even a healthy individual, which is, again, going back to vaccines and the benefits of vaccines for the more common infections that we do have those things for. And of course, when you're around sick people, just be mindful about that, maybe wearing a mask if it's appropriate, et cetera.
Mm-hmm.
But the cornerstone of preventing illness in general is a good, healthy lifestyle, which is
Yes.
eating well, exercising, strength training, and again, being mindful of what you eat and focusing on keeping a strong body. All of that is going to be helpful for preventing almost any disease.
Well, thank you so much for joining us today. How can somebody schedule an appointment with you? I think we're going to show that up on the screen.
Absolutely. So we are here at Terrebonne General, the Pulmonary Clinic. We proudly serve this area and this community. You can send a referral via your primary care or any other provider, really. And you can call us at 985-850-6090. Give us a call, and we'll be happy to see you. We have a tremendous group of providers, and we are, again, proud to serve this community.
Thanks so much. We appreciate all the insight.
It's my
You
pleasure.
heard it for yourself, everybody. A healthy lifestyle is the key to everything.
That's
Good
it.
diet and
That's it.
exercise.
You start there before you do anything else.
Right.
Yeah, that really is the prescription that we should give up front, and then we'll put everything else on top of that.
Great. Final last words. Perfect. Well, thank you so much for joining us. If you need more information about Dr. Ugo or COPD, please visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get podcasts. Thanks so much.